Imaging and radiation hazards during pregnancy. One of the very important subjects during pregnancy, because during pregnancy we meet many problems that needs use of X-rays, use of MRI, use of ultrasound, and other modalities of diagnosis. And many people who are pregnant, their workplaces, they may be exposed to X-rays, to high power fields, and this also might affect pregnancy. So we have to understand what to do. So during pregnancy, in this subject that we will find at the first comment after the lecture, we will find how we can use, and the safest method so far is the ultrasound that can be used and can be used for getting samples. Then follows the MRI. MRI, it doesn't hold any ionizing radiation. Still, so far, the American Society for Obstetrics and Gynecology recommended not to be used during first trimester, but we weigh risk against benefit ratio, and it can be used during the whole pregnancy, but without any imaging or any fluoroscopic data to be added, or any subject that can be used like iodides as a dye during this technique. Also, it's very strange, and you will know that X-rays can be admitted during pregnancy because we have in the X-ray what we call deterministic and stochastic effects. And deterministic, it means the effect of exposure to one X-ray film or so on. And we can understand that even CT films doesn't reach zero point 0.5 rad, and this is nothing if exposed during pregnancy. And we can do CT, we can do fluoroscopic examination on the brain and the heart, and also we can do X-ray chest without affecting the fetus. But we have to understand when to do, and the importance of such subject. And the stochastic effect, this is the accumulation of X-rays and the effect upon years after exposure, and it was thought it might lead to sarcomas and so on, but this is proved to be theoretical. But we use X-rays when needed in a limited fashion, and we doesn't cause any abnormality. And the American Society of Obstetrics and also of Radiology recommended that we don't abort any woman if exposed to one film of X-rays or to CT in the first trimester. And we have the 10 days data, or even what happens is all or none low. Either the pregnancy continues if exposed to deep X-ray, or the pregnancy will be lost. So we can use these data. Also, we can use these things for diagnosis during pregnancy. If we come to work hazards, those who aviators, and we have some kind of magnetic fields that might affect the fertility, and they measure exposure to these data every time that calculated by computers. And the females and males working in X-rays, doctors and nurses, they measure the dose of exposure, and they avoid to use it during pregnancy in order to have extra doses. And even extra doses of X-rays nearer to the thyroid gland might lead to cancer thyroid. That's why we don't use mammography in young age, except if mandatory, and it's replaced by sonomammography and MRI. So these modalities for diagnosis is very important, and they can be used during pregnancy, and we weigh risk against benefit ratio, and this all will be found in the presentation found in the first comment. Thank you.